Alex and Bob. Welcome to EHI Live. Thanks for your time today. So I want to start by asking, how are the expectations of patients changing and what is the impact on IT service delivery?
I think a big part of that is how we adopted technology in our own lives at home. And we take that expectation now into the visit in the hospital with either our GP or our specialist physicians. And it becomes a boost of confidence to see that the organizations are adopting technology and that providing you kind of the best care possible associated with that.
I think it's maybe not just the expectations of patients, but also clinicians and staff within a hospital. Your ability to deliver the care services is greatly improved if the technology just gets out of the way. We all expect things to just work for us in the way that we like, and also to, for applications to perform well, so that they don't get in the way of us completing whatever it is that we're doing.
How should healthcare organisations approach managing and measuring application performance?
That's actually one of the hardest things for a typical ICT organization, because so often with application delivery, you're dealing with a quality of experience that is very subjective and objective simultaneously based on the users. And so we have to really look at network performance and then the visibility into how the applications are performing across a variety of environments, client devices, and even workflow scenarios to give a determination and kind of help support the challenges around performance delivery.
I think as well, when we look at how the services are deployed within a hospital, very often we have a large number of providers. And they can be anything from managed service contracts provided to, say, a hospital or an organisation providing care. And I think it's really important that those organisations maintain the intelligence and ability to measure the performance of the services that they're receiving. And that ability allows us to then maintain high levels of performance, maintain high levels of standards, and indeed, where we started, those applications just to work in the way that our users, our patients and our staff expect.
What operational challenges is IoT device adoption posing for healthcare environments?
Well, to start, a lot of IoT devices seem to be based more on consumer grade technology and not necessarily enterprise grade or clinical grade needed in a healthcare environment. So as we're adopting these devices, what we're seeing is that they're now outnumbering the staff inside of a hospital organization, and there's very little visibility into the individual behavioral characteristics of what these devices are doing, almost behind our backs. So that visibility to understand how they're behaving, what is natural for them, how are we controlling them from a safety and a security standpoint.
Yeah, we see some of these devices, like things like a security camera, as a security camera, but actually when we look at it from like the IT perspective, that camera is probably running a web interface that allows you to manage it, which means it's also a web server, which means it can do so many other things. So actually in an IoT environment, the level of risk, especially to patient safety and confidentiality, is actually vastly increased just because of the quantity of devices out there. And in terms of operational challenges, we can control those devices and we can protect them from outside influence and stop them from having an adverse effect on anything else. But that becomes a very, very or a big overhead in terms of operational management. So anything that we could do to automate provision of services to those type of devices is very important in a modern healthcare environment.
How does Extreme Networks help to address security and safety risks with medical devices?
We actually, in the background, are doing a lot of activities in coordination with medical device manufacturers around industry best practices as well as the regulatory organizations, making sure that there's a general awareness now between both healthcare organizations and the manufacturers around what are the risks and how are the evolving best practices taking place and how an ICT organization can then implement them in their own organization.
Yeah, it's also helping us to further develop our products so that we can automatically identify those types of devices and then provision them with a service, exactly like I said with the previous example. Another good example of this is take vulnerability notification on an IV pump. There was a recent one just last year. the mitigation associated with that notification was remove all of those devices from your network, which is great, but then there's, you remove the risk, but what you do as well is you then impact the delivery of clinical services because you've taken a key device out of the care environment. So we also have the ability to control all of the traffic and services that can contact that device. And that can be changed centrally on the fly for the entire infrastructure. So it allows us to be very, very dynamic and very responsive in a high-risk environment.
What can Extreme Networks do to protect critical health infrastructure from malware and ransomware?
I think the first thing we start is with education of our customer base and the general ICT community around how best practices are evolving, and then how to best implement the safeguards necessary around automation and control into every environment.
Yeah, it's also about visibility, so constantly monitoring what is going on within a healthcare environment. You mentioned the education around best practices. We already mentioned some of the IoT type devices, and they actually do a lot of other things other than just what is advertised on the outside. So they could be performing other behaviors. They might be doing odd things on the network. They may be transmitting sensitive information off-site to other locations which we don't know about. It could be a point of data breach. By enabling visibility of what's actually going on at the network level, we can much more easily identify those kind of breaches and those leaks. So that, combined with the dynamic service provisioning capability that we mentioned, really is a way for us to identify if we have a breach or a risk, find out where it is, find out how it's occurring, and then respond to it by protecting it, stopping it, and then obviously mitigating the risk ultimately.
Bob, Alex, thank you very much for your time today. Have a great show.
Thank you.